Good afternoon, everyone. Thank you all for joining us today, our webinar focusing on oral health and colorectal cancer treatment. My name is Zach Getty, and I am the Patient Education Program Manager here at Fight Colorectal Cancer. A little bit about Fight CRC. Fight Colorectal Cancer is the leading patient empowerment and advocacy organization in the United States. We strive to provide balanced and objective information on colon and rectal cancer research, treatment, and policy. We are relentless champions of hope, focused on funding promising, high-impact research endeavors while equipping advocates to influence prescription and policy for the collective good. Before we get started here, I have a couple of housekeeping items I'd like to go over with everyone real quick. We will have some time at the end of the presentation for questions, but please feel free to use the Q&A panel on the right side of your screen to ask any that come up along the way. If you hear something that you want to ask a question about, type it in that Q&A panel and we will answer it at the end of the webinar. We'll do our best to address them at the end, and we'll try to get to everyone if there's a lot of questions. We will have the recording of this webinar available on our site in the next few days. If you've registered for this, you will receive that direct link via email to the email address you registered with us as soon as it is available. And last, please feel free to tweet along with us. You can use the hashtag CRC webinar. So I've got one more disclaimer. Information and services provided by Fight Colorectal Cancer are for general informational purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnoses, or treatment. If you're ill or suspect that you're ill, please see a doctor immediately. In an emergency, call 911 or go to the nearest emergency room. Fight Colorectal Cancer never recommends or endorses any specific physicians, products, or treatments for any condition. So, with that all out of the way, I'd like to briefly introduce our participants. Joining us today are JJ Singleton, a Fight CRC Ambassador and colorectal cancer patient and survivor. And we have joined with him his provider, Dr. Sylvia Jernigan, and dental hygienist Laura Inman, who both work at the dental clinic he goes to. Thank you all so much for taking the time out of your schedules to join us today. I'm going to hand it off to JJ, Dr. Jernigan, and Laura so they can introduce themselves a little more thoroughly and get this webinar started. And please just let me know when you're ready to advance slides, and I will do that on your cue. So,
I'm JJ Singleton, as many probably know. I'm a stage 4 cancer survivor diagnosed in 2015, a Fight CRC Ambassador. And most people that know that's followed along with my life with cancer have known I've had many issues with oral health, my teeth, mouth sores, everything involved in that. It was one of the worst side effects that I had through my whole cancer journey, and still to this day, I deal with it. I've been lucky and blessed to be under the care of Dr. Jernigan and them at Dr. Highsmith's in Clyde, North Carolina, and just honored to be here to, help people understand the oral health through treatments. And I'm going to pass it off to my amazing dentist.
Thank you, everyone, for joining us today. Again, it's important to share the knowledge that I have and Laura have to help you be better, because again, the journey is going to be long for you and you have to have something to eat with. And if you don't, it's going to be harder on you. So the most important part we're going to talk about, we're going to focus on cavities and gum disease. But before I get there, a little bit about me. I was born and raised in Poland, so you can hear my little accent. I did dental school back in Poland, and I did it again in the United States. I work with amazing people, team of people, and one of them is sitting next to me. That she decided to join me, so I really appreciate you, Laura. Mm-hmm. And Laura has been with our office for 30 years, and just it tells you, how dedicated we are to what we do. All right, Laura, you want to add something?
Yes, like she was saying, I have been practicing clinical hygiene for 32 years. 30 of those years were with Dr. Highsmith and now Dr. Jernigan. So I've had the opportunity to treat and see lots of patients who have different forms of cancer and the complications that this poses. So hopefully today we can give you some insight on what to expect or how we can help you.
So this is our team of people that we work with every day. Me, Dr. Heisman are in blue. The rest of our amazing team are wearing black. So we can try to find everybody, but there's 10 of us?
Yes.
10 of us. All right, let's keep going. So whenever I was getting this presentation together, I kind of did I didn't want to present any kind of articles from PubMed because it's a little more advanced information that we want to deal with, because not everybody's reading medical research and things that you want to worry about when you worry about your teeth. So I just did a Google search and I ran into 2 different articles, and one of them was from New York Times, which I felt like it's not a medical grade newspaper, but still it gives you pretty good information. And the article was saying about gum disease tied up to the colon cancer. And it all comes to a certain bacteria again that live in everybody's mouth, and everybody has different biome. Biome is like a spectrum of the bacteria that everybody has, and those bacteria can produce different toxins that they found that it's related, or they found connection between colon cancer and gum disease. And in the next slide, it shows you that it was actually a study done in the dental school, Columbia University. And then they found that, again, there's certain bacteria that is responsible for cavities. And the name of it is Fusobacterium nucleatum. And that bacteria is, again, responsible for tooth decay. And there is connection between the toxins that that bacteria releases and the colon cancer. So again, just easy information that it's out there, but again, how reliable it is, if that's the main cause that causes colon cancer, not really, but again, there's a relationship. So people that are fighting that type of colon cancer, more likely they might be prone to have a gum disease, or more likely they will develop more cavities. All right, let's keep going. So this is information that, again, it's from dental knowledge that I have. There's 3 reasons why people lose teeth. One of them is a tooth decay, which is definitely a bacterial disease. Then we have a gum disease that it's, again, bacterial disease, that there's certain bacteria that cause bone loss, gum loss, and overall that can cause tooth loss. And then the third way why people lose teeth, it's incorrect bite, which we don't really worry about this because this is not related to bacteria. All right, let's go to the next one. So decay, different way calling cavities. It's definitely a bacterial process, and most people don't have problems with decay unless they cannot control their plaque. Plaque is the white stuff that Laura has a nice way of saying, what do you call this?
Bug poop.
Bug poop. There you go. She calls it, whenever we talk to little kids, that's what we use, so they understand really well. So the white stuff that sticks to your tooth structure when you don't brush teeth for X amount of time, that's what causes decay. Basically, the white stuff sitting there for a long time makes the tooth being softer with time, and then the cavity shows up. So there's different stages of cavities, and it starts always with the white spot. Then the second stage is enamel decay, and white spot enamel decay, it is still reversible process. So at that stage, if we catch it at that time, we still can reverse it or stop it at the level it is, and we don't progress further. The stage 3, which is dentin decay, and then stage 4 and 5, unfortunately, they have to be definitely addressed by us, meaning fillings, crowns, root canals, or sometimes extraction. All right, let's go to the next one. So this is a picture showing you a white spot. And white spot, from the perspective, as you see on this photo, it can look different on different patients, and it's not always, oh gosh, I have a white spot. Is that a decay? Sometimes we have braces and the white spot look like that after brackets being put on, and then because we didn't brush teeth well during that process, we see those spots after the brackets come off, and unfortunately they will be there for life. They won't go away. Sometimes we have something called dental hypoplasia, which is like a defect how our teeth were growing and they have white spots, and this is not decay, but again, it's white. So you have to be careful before it's like, oh, do I have decay? No, you just have to pay attention to where those white spots are. So most of the time when we see decay or the first stage of decay, it's right at the gum line. And why is that? Because this is the most common spot that we miss with the toothbrush. And a lot of people say, oh, I don't know, it's like I brush my teeth every day, I do everything, whatever my dentist tells me. But again, like I told JJ, if you don't know what you missing, you say, oh, I did, good job, but I don't know. So let's go to the next slide. So this is kind of showing you a photo of somebody that was missing quite a bit of plaque to be removed from the teeth during brushing. So the only way you can know if you removed or didn't remove, it's like you have to see it. And unfortunately, it's white. The only way we can like indicate that using certain products that I will show you in a little bit where to get and how to apply it and what to do with that. All right, so let's go to the next slide. So like I mentioned, the white spots come from not brushing hard enough. And I always tell people, it's like you have to move the bristles of your toothbrush towards the gum. So you don't really brush your teeth that well. You just try to really focus on your gums to brush gums really well. And that's when you will remove all the sticky stuff from where the plaque is sitting. Like I mentioned, the plaque is a white substance, and it's made from some of the food particles, and it's mixed with bacteria and your saliva. And what does it do? So basically that stuff is sticky and it has bacteria. Bacteria has toxins. Toxins will create acidic environment and will make the tooth softer, and acidic environment makes like dissolve the tooth structure. And a lot of people say, how soon does it come back? Or as soon as you brush your teeth, it's within 30 minutes. And then you start seeing, if you take a microscope, you can see the little particles starting to attach to your tooth again. So this is, again, it's the first stage of the cavity, and it can be reversed if you maintain it or you clean it. If we go to the next slide. So this is
this is a way that we can find plaque on your teeth. So it's kind of like a little red dye, and it indicates plaque. So we can rub this around on the teeth, and it shows you where you're missing the plaque when you brush your teeth. So it's a plaque indicator, but it just shows us what you're missing on your teeth.
So I usually tell, or I try to explain to patients, like, don't do it first before you brush your teeth. So brush your teeth first and say, oh, I think I did a good job. I floss, I did everything. And then put this in, either this is the liquid version. And then in the second slide, there is a tablet version. So you can get those. This one, and this is showing you actually how your teeth look, even though you say, oh, I brush my teeth. And then we put this tablet in, or the liquid in, and then you see what you have missed. So I always say, brush your teeth, floss, and then use the tablet and see what you have missed, because that's what kind of tells you is like how good you did, and then how much more you have to work on certain spots. Because again, some people are right-handed, some people are left-handed, and usually on the right-handed people, the left side will look way better than the right side, because again, it's all about the position and how tired your hand is and how you work around that. All right, so let's go to the next slide. All right, so this is a little, I went on Amazon and you can get this. This is disclosing tablets for kids, and they work exactly the same way as the solution, and you can get it. It's not that expensive. Is it like $15? And you don't have to take the whole tablet. You can break the tablet in half and take a half of it, and after you brush your teeth, use it, and then see how great you did or how bad you did. And then that will give you the information, you know, how much more you have to work on that. All right, let's go to the next one. So I am big advocate on electric toothbrush. It really doesn't matter what type of electric toothbrush it is. Those are two big names that they're out there. They're not that expensive. I found it even for $19 Sonicare, so it's really affordable for, I feel like, everybody. Oral-B wasn't, Oral-B, again, the cheapest one I found was like $45, so it's still, they might have to come up with the price to be competitive with Sonicare. But again, it doesn't matter what you have, as long as electric, and you need to change your head brushes at least 2 months, 3 months. It depends how worn the bristles are. Because again, if the bristles are like flat and spreading apart, they don't really do a good job. So you have to pay attention to that. And let's keep going to the next one. So this is another part, and Laura is really, it's not just toothbrush. You have to use something to clean the teeth in between. And there, of course, number one is floss. This second picture is showing that actually you can floss, attach the floss and change, and it kind of, it's not a single use. You can change the
Winds it around.
yes, it winds
Yeah.
it around. So it's like you can use the flosser to clean in between if you have a hard time with your fingers. The gum picks are great.
Mhm. Just whatever that you can do is great to clean in between the teeth. And sometimes it's easier to use a gum pick. I just find that a lot of people don't really love to floss their teeth. I don't know why, but no, but if you can get something in between there to clean it, a water pick, I'm just going to jump ahead just a little bit. A water pick is a wonderful adjunct or addition, but it will not do the job of one of the gum picks or the floss, because you've actually got to rub the sides of the teeth to disrupt the bacteria to do what you need to achieve. And a water pick will flush that, but it will not remove the bacteria. So that's something that you can use in addition to brushing and cleaning between the teeth.
All right, let's jump to the next one. So let's talk about a little bit about toothpaste, because there's so many different products on the market, but because people that go through cancer treatment, they're at the higher risk of developing cavities, because there are good days that, as you know, you wake up and you're like, I am not able to do anything. I just have to survive this day, and I don't feel like brushing my teeth. I don't feel like, I just want to sleep. I don't want to do anything. I've heard that stories, and I know that it can happen. So we want to deliver something to your teeth that you don't have to be as paranoid or stressed out. That will help to make the tooth stronger for longer, because definitely, you know, if your mouth is pristine and there's no plaque and whatsoever, then you don't have to be paranoid. Am I going to get a cavity next time I go? So doing this additional thing, even though I know there's some people that are against fluoride, but again, we strongly believe it works and it helps. So there's 3 products that we actually use here in the office. One of them is CleanPro, and I think JJ is using CleanPro. There are different flavors. If you don't like mint flavor, there is a vanilla mint and there's a bubblegum mint, I think, because I saw it on the on their website. MI paste is another product on the market, and actually they have way bigger variety of flavors because they actually make stuff that it's totally non-mint. There's strawberry, melon, watermelon, all
Lots of good
flavors.
yummy flavors, right?
And then Old Prevedent is the oldest product I think on the market, and it's the typical mint flavor, but again, they all work great. This is something that a lot of patients that we see with cancer, whenever there are patients here in the practice, we do something additional. And I think JJ has it too. We make them something like a fluoride tray, which sometimes they will do a treatment once a day, whenever they can, to put the little solution in the tray, and they leave that for 5 minutes, and then they take the tray out, and then they don't have to be as paranoid about cavities. So we do that for them as well. Do you want to add anything about those?
No.
All right, let's
Thank you.
go to the next one. All right, so next, so as we talked about products, another thing we are big on, again, when you have a bad day, you don't feel like brushing your teeth and you're like, I cannot do any of that because I don't feel good. What you can do, definitely you can rinse your mouth with water, but if you use something that actually is antibacterial, like one of those mouthwashes that I have here on the website, and there is a really good website that I included. It's called Carie Free. They have different products to lower the bacterial count and help with the fighting decay. That's something that will definitely help. And, you know, if you cannot brush, at least rinse for a minute after each meal if you eat that day, but definitely still rinse and help with that, breaking the bacterial count. Anything else? All right. Oh, and this is something that Laura will talk about.
So what I find when I treat patients clinically that are going through chemo and radiation is the horrible dry mouth, and it makes your gums sore and your tongue sore. So I understand, and these are a couple of products that you can use, because what gets a lot of people into trouble is they'll put candy in their mouth, peppermints, Tic Tacs, and that is instant cavity. So what we want is to try to find something that's easily available for you to get that will give you a little bit of moisture in your mouth. And so we've included a couple of things. There is Spry. That's a product that has a couple of different flavors. You can find it at a lot of health food stores, but what it is it's got xylitol. It contains xylitol in it, which is actually also a good antibacterial. And then the other product is called Act Dry Mouth Lozenges, and it's a very mild, pleasant mint flavor. And it's just like a big giant piece of candy, but you can actually put that in your mouth and suck on that piece of candy, and it will actually give you a little bit of saliva and make things taste better. And it's very soothing for your mouth. So be very careful what you're putting in your very dry mouth, because you will get cavities a lot easier. So these are 2 great products that you can try.
All right, let's go to the next one, please. So like I mentioned to you, the next, so we went through the first stage, which was white spots. The second stage is enamel decay. And this is when the enamel of the tooth, the outside shell of the tooth starts to break down, and we see a mineral loss. And actually we can see that at the x-rays whenever we take. And it's still sometimes whenever we do eat different colored food, and we see sometimes that on the people that use tobacco products, if they use a lot of it, those white spots will turn black. And that's when they usually come to us and say, hey, can you help me with this? And I'm like, well, it's not really a cavity yet. But again, it's something that we see quite often, that enamel is broke, like there's a breakage in the tooth structure, and whatever we put in our mouth, meaning anything that has any kind of color, again, tobacco, red wine, lots of black coffee, it will actually stain the tooth, and that's permanent, unfortunately, and you cannot take it off. All right, let's go to the next slide. So this is actually one of my patients, and unfortunately, you can see the white spots that he had in 2015, and we gave him enough information, but again, he didn't listen to what we told him, and then he ended up, as you can see, with few teeth broken. There's decay at the gum line, and that's where he basically missed the spots that he was using the toothbrush with. He just basically didn't brush those spots well enough, and he got the cavities. Sorry about the phone. All right, let's go to the next one. And this is another one of my patients. And this is picture showing you from 2015 to 21 and 23. And again, it shows you how quick this can progress from the stage that, somebody that brushes but doesn't brush as hard enough and gets the cavities that shows up there. All right, let's go to the next one. So this is a kind of little photo showing you what's the stages of the decay look like. So as I said, the first stage, which is white spots, second stage, enamel decay, and the third stage, which is a dentin decay. This is all easy to fix because it's still, we can put the filling most of the time. If sometimes we will have to put the crown on the tooth, but it's rare. But if we can catch it early, we still can fix it. If we go to the next slide, on the stage 4, which there is a pulp involvement. Pulp is basically the inside of the tooth where the nerves and vessels are in, and then whenever decay gets all the way to that part of the tooth, we sometimes have pain, and sometimes patient will say, it wakes me up at night, and this is what happens quite often. And then we have to say, hey, at this stage we need to unfortunately do a root canal, which is still savable tooth. You still can use that tooth for a long time, and then after that the tooth more likely will need a crown to preserve it for further damage, but still you still can save that tooth. And when we go to the next slide, so whenever we have such an advanced decay that there is so much tooth loss and so much infection in the tooth, sometimes we end up with the abscess, and abscesses are life-threatening sometimes. Some people, I would say life-threatening in kids are definitely something that we are very, very aware of and we have to pay attention to. But again, on an adult, it can happen as well. And when you start seeing swelling, this is, you have to call your dentist right away. And then sometimes the dentist cannot even be involved. Sometimes you have to see oral surgeon because they might have to incise and drain the abscess before they actually can take the tooth out. Because at that stage, sometimes the tooth is savable or sometimes it's not. It just depends. All right, let's go to the next one. So, so we all talk about, the decay and then what makes the decay. And you have to kind of start going back. Again, it's a bacterial disease. Bacteria live on certain products that we deliver to them when we eat. And when we eat, I kind of explain to patients whenever we talk about day-to-day, I call it behavior, like, okay, so what is your day looking like? What do you start, what's your breakfast? What do you do after breakfast? So I have to learn before I kind of help you, I have to learn what do you do day to day, so I can figure out where is the mistake made. And again, it's like they don't teach us about that in school. It's like we have to kind of share this knowledge. So when we get up and eat breakfast, most people brush their teeth after. And then what happens after you brush your teeth, usually most people, they just should drink water and then have lunch after. And then after that, sometimes you will brush or sometimes you don't. But a lot of people do, like they snack. And I know whenever you don't feel good because you go into a lot of treatments and you feel pretty, I feel nauseous, I have to do something, I have to help so I don't throw up again. I understand, but you have to know what comes with that. So again, the pH of your mouth after you brush your teeth, we call it normal, which is around 7-ish. And then as soon as you put something back in your mouth, it doesn't matter what it is, but unless it's water, it has some kind of acidic impact on your mouth. So snacking, I call it anything that have carbohydrates, cookies, chips, crackers, anything that have carbs will have that content that will make your mouth more acidic. So a lot of people will say, what about drinks? Like, what if I drink something that doesn't have any sugar? Well, you still need to read that label because a lot of that stuff has acid, and it's acid added for flavor. And a lot of those soft drinks have citric acid, they have phosphoric acid, they have malic acid. And that will cause the drinks to be more acidic. That what makes the taste good as well. So this is something that you have to figure out what's best for you. And again, I understand that whenever you do the chemo treatments, it's not the easiest day for you, but still you have to sometimes think like, what's the outcome for me long-term? All right, let's go to the next one. So I ran into an article that the name of it is this, the link is on the bottom, and it shows you how acidic. So again, like I said, that acidity around 6.77 is good. So those are the names of the different products you can buy pretty much everywhere. So if you look, the Campbell tomato juice is the best one on this slide because it has pH of 4, and then everything else is way below. Let's go to the next slide. So on the next one, we have water, which is good. And then what else is here? That's another water. Okay, so I actually found this, and I am drinking, even though it says alkaline water. So this one has pH above 7. So that's something that can help you to bring that pH back to normal. And again, I know whenever you go through, and I don't know how nauseous you can get, and what do you do if you actually go and throw up? What do you do? Is like most people say, oh, I have to brush my teeth, it feels so bad. Actually, we don't want you to do that, because when the acid comes back from your stomach, it is so strong that it can dissolve your teeth. So the worst thing you can do is actually put the toothbrush with the abrasive toothpaste and brush your teeth. So rinse, and leave it alone. And get rid of the flavor, but try not to brush your teeth, because that's when the teeth are actually softer. And let's go to the next one. Next slide, please. Oh, I skipped it. I didn't. So again, on the other ones, it shows you all the different names of the great drinks and bad drinks. And I hope nobody drinks those because I don't. So Laura will talk to you about a little bit about gum disease and what it is.
So the next thing is with periodontal disease, it's also bacteria. And, these bacteria live in your mouth and eat the food that's left on your teeth, as she was saying. And they have to get rid of waste, just like every other living organism. And that's what we were saying. That's why I call plaque, which is some of the bacterial waste. That's why I was referring to it earlier as bug poop, which is sticky and sticks to your teeth. And then that bacteria come back and they form more colonies around that plaque. So your body senses that as an infection. And it's kind of like having a splinter in your foot or, things of that nature, because then your body starts to try to get rid of this irritation or this infection. So the first thing is you get inflammation, just like the splinter in your foot. It swells up and you get fluid. The inflammation is what we refer to as gingivitis. That's the first stage. Your body's also trying to rinse out this infection, so it increases the blood flow. And with that comes white blood cells that are going to try to engulf and take away that infection. But it's hooked to your tooth, so your body can't flush it away. So basically what it ends up doing is it starts to create or to trigger some chemicals and hormones to be released in your body. And over time, those hormones will start to melt the bone away from the sides of the teeth. Well, the other bad thing is that this bacteria that's in here, the really bad bacteria that shows up in gum disease, doesn't need air to breathe. So that means it can live below your gums. And I'm sure that you've heard before people talk about heart disease and infection. This is also some of the same bacteria that we were looking at earlier when it said colorectal cancer. So this is where that bacteria climbs into your bloodstream and invades other areas of your body. So these are what we were talking about with the stages of gum disease. And we'll say, oh, you've got gingivitis or you've got bleeding. And that's why we're always nagging you to clean between your teeth. Most of the time, people are pretty good brushers, but you're only getting half of your teeth when you just brush. So over time, that's why we lose the bone and we lose the gum around those teeth. And then that's when the teeth will get loose. And that's when you will start to lose the teeth. So we want to stop it by getting you on a good routine of cleaning things so that it doesn't come to the stage that you're going to lose teeth or that you've got a constant bacterial infection that's surging through your body because of the bacteria that are below your gums.
Right. And like Laura mentioned, there are different stages of gum disease. We have gingivitis and periodontitis, and they're, again, at every stage you can manage that, but again, we don't want you to get there because that's when your inflammation levels will be higher, and then it's not just that infection in your mouth, but again, you're fighting overall other parts of your body is fighting, your immune system is working to get healthier. And again, that's not something we want your body to focus on. So don't get there. All right, next one, please. So those are some facts about perio disease that I found. It is most common oral disease among Americans. There's a good statement from all of us, dental professionals, that healthy gums do not bleed unless you go through a chemo and they alter your blood count and whatever you do, and they will bleed. I know that. I've seen it, and this is something that sometimes you cannot avoid. Puffy gums are signs of perio disease. Bacteria again builds up around your teeth and leads to irritation of the gum tissue and leads to inflammatory response. And receding gum, sometimes we see it, and sometimes it's not just because you have gum disease. Sometimes there might be other factors. So if you see it, you have to ask your dentist if this is do I have a gum disease or this is something else. The sign of gum disease is also a bad breath. A lot of people don't connect those two, but it is definitely their reason. And then again, it's the bacteria, toxins, and everything that sticks to your teeth that can make the bad breath show up. And some people also tell us that they have a bad taste in their mouth and they cannot realize where is it coming from. All right, let's go to the next one. And also, whenever we have gum disease, we have sensitivity that shows up mostly to cold and sweets, because again, the gum pulled away from the tooth structure, and now we have more of the tooth exposed that usually it's covered with the gum, and it's more sensitive to again, cold and sweets. And the worst thing that can happen is when we start seeing moving teeth. And again, it can be caused by severe gum disease. And let's go to the next one. So this is a picture of gingivitis. And basically when you see like inflamed redness around the teeth, that's when we know that the gums are irritated because there's stuff sitting on the teeth. So most people say, what do I do? It's like, if I brush harder, it's going to bleed, and it will. We usually say for 2 weeks, you have to work around this and it will go away. All right, and next one. And this is again, one of pictures of our patient, and this is severe gum disease to the level that actually that patient lost all his teeth. So this is, again, you see all the tartar and all the yuck stuff that's sitting on the teeth over the years that never were taken care of. And that's where he ended up. All right, and the next one. And I think we can wrap it up. Laura, do you want to add anything?
No, I would be happy to take some questions. I think that when I see patients who are going through any type of chemo or radiation and they have a dry mouth, our goal is to, it's as Dr. Jernigan said, we want to try to keep the pH up in your mouth so that there's not as much damage going on. And we're going to try to get you to rinse with water, use these products that we were telling you to when you can't brush. It is going to at least make some spit, some saliva in your mouth so that we can keep the pH up so that you don't get damage in there. And so you can use those. If you can chew chewing gum, sugar-free chewing gum, that helps. Some patients have even told me that it helps with their nausea. I don't know why, but I have heard that several times. But if you can chew a piece of chewing gum, it makes you make some spit in your mouth. If you can't rinse your mouth, the products that we showed you, like the closest mouth rinse, if you can at least rinse your mouth out with something like that. Now, there are always, whoever is treating you, your doctor, they always have their guidelines, and we always want you to go by what they're telling you. So these are just some extra things that you can do so that we can get you through this and have you have a healthy oral cavity or a healthy mouth while you're going through it.
Thank you. We do have a couple of questions that came up during your presentation, which thank you very much for that. The first one we hear is our toothpaste, our flavored toothpastes loaded with sugar. Are they bad to use?
I have never seen any toothpaste that have sugar. I mean, Now, let me rephrase that. Mainstream toothpaste. Generally, they're flavored with something called xylitol. And I'm sure that you've seen that in recent years, xylitol. What is so good about that is that it's a sweetener that comes from beech trees, tree bark, basically. So it is an all natural sweetener. And the good thing about that is, and they don't exactly know why yet, but the bacteria are very attracted to xylitol because it looks like sugar. So they eat it, and for some reason, when they eat it, they die, but they don't know why yet. So those are the only sweeteners that I've actually ever seen in toothpaste.
Thank you. How bad is it to drink water with lemon? And you were talking about the acidity of beverages earlier. So specifically water with added lemon, is that going to be acidic?
Yes.
Yes. And I've seen many patients that will say, oh, well, I just drink some lemon with water, but it really does start to break down the enamel. And I've seen this with people who are having this once a day, just a regular, like an 8-ounce glass with lemon squeezed in it. And you can see where it's beginning to break down the enamel on their teeth.
Thank you. Any advice for problems with mucositis, sores? Can I use a vitamin supplement to help the membranes in my mouth? So kind of a two-part question.
So with those, we sometimes give, and your doctor can probably prescribe it. It's called magic mouthwash, and there's different formulas for that. But they usually have Malox, they have hydrocortisone, sometimes they have steroid, and it's basically a compound made mouthwash that can help with soothing those, because again, it's all related to changes in your body when you go through chemo, and you basically try to soothe it. So nobody can give you a magic pill that will cure it. It's just more like try to make it go away as quick as possible and not irritate your mouth. So again, you have to talk to your physician, to your dentist, and say, hey, can you prescribe me magic mouthwash?
So thank you. And then I have a fairly specific question. Can immunotherapy, specifically the drug Opdivo, cancer treatment, cause neuropathy and then tongues and lips? Is that anything you've ever experienced before?
I've heard of that, but I haven't read anything that's definite. It's just one of those kind of passing things that I have read about. So the answer is I don't know, but I have heard of it.
Thank you. So to everyone watching, please, we've got a couple minutes left. If you have any questions, feel free to put them in the Q&A section. I have a question. Is there any specific one thing that you can point to about cancer treatment and chemotherapy that is responsible for tooth decay and just problems with your mouth in general, or is it kind of a global phenomenon where we have a variety of things kind of coming together and causing problems?
So in my opinion, it's all, again, it comes up, how well do you brush throughout the treatment? Because again, I feel like patients have good days and bad days. And I say, whenever, an example of myself is like, if I do a good brushing of my teeth, it takes 4 to 6 minutes just of brushing and getting rid of the plaque that collects for a whole day because of whatever I'm doing, because during the work day, I don't have time to brush my teeth in between, very terrible. But again, it's time that you have to put in to clean your teeth. And again, sometimes when you put the toothbrush, in my opinion, whenever you are going through chemo and you feel nauseous, you can feel worse. So again, unfortunately, tooth decay or gum disease is all bacterial problem. So if you get rid of that white stuff that sticks to your teeth, you won't have it. yes, you're at the higher risk because you have dry mouth because of the changes of your saliva flow and all the things that they're involved with that. But again, if you keep your mouth pristine, I would see it way less than if you didn't. So that's my biggest input. If you take my advice, take those tablets and work on your home care, you will not be seeing your dentist fixing tiny little patches, try to get you through another 6 months till you see them again, because again, they will pop out somewhere.
Thank you. I have another question that popped up. My teeth are very soft since treatment with both chemo and radiation. What can I use to strengthen them?
So again, did they got soft before the treatment? Were they already at that stage? Or again, like I showed the photos, this soft stage or the white spots, that's what we call the soft stage of the teeth. So this is something you have to keep working, trying to get rid of the plaque and get rid of it, and then using those fluoride products to make sure that that doesn't transfer into the second stage enamel decay or dentin decay, which is the third stage. So that's the biggest thing. Can you totally get rid of them? No, they will be there for a lifetime. If you, whenever your treatment is over, if you don't like how they look, then you have to talk to your dentist about doing veneers or something to cover that. But again, this is all more elective treatment, we call cosmetics, if you don't like it.
Yeah, I would say they're soft, that they're soft because of all the changes during treatment is what I would say. So, it's keeping the pH up in your mouth so that they don't get softer and become decayed. So there are all those products out there like the fluoride, that's what she was talking about, so that you can strengthen the enamel on your teeth. It's usually all a plaque, bacteria, and a pH thing that's going on in your mouth during treatment. And that's what makes those soft spots, and that's what makes the teeth soft.
Thank you. And then JJ, I know you mentioned this at the beginning of the webinar that it's kind of known that you've run into some problems with your oral health and teeth. What, if anything, do you wish you would have known for starting treatment and starting taking care of the problems that you had? I know it's kind of a broad question, but is there any advice, tips, things you'd like to share?
Yeah, I wish I would have knew pretty much all of this before, because I don't remember ever getting set down and went through the stages of everything that could go wrong with my teeth. But the biggest things that's helped me as I've been going to the dentist, those tablets, because that during treatment week, I'm too tired. I'm nauseous. I don't want to brush that much. I don't even want to get out of bed. So I can use those and I can like pinpoint the worst spots that are in my mouth. And I've been using those for over 6 months now. And this last time was the first time I went where I didn't have any cavities and didn't have to go back and get drilled on and stuff. And I think it's because of those. And then the toothpaste, because I have such a raw mouth, my mouth and I have sores all over it. That Clem Pro is the only toothpaste I've ever had and out there that doesn't burn. So I don't mind. Before, I was trying to brush as quick as I could because the toothpaste was burning my mouth so bad. Now that I use this, I can get in there and brush as much or as good as I need to. And those are the things I think has helped me the most, along with the lozenges, because I have dry mouth every night and stuff. It's just part of life, and it's horrible, but the lozenges really help me.
Yeah. They taste pretty good too, don't they?
They do. Even though they're a mint flavor, they don't burn bad. Even my mouth, it'll burn a little bit just because it's so raw, but it's 10 seconds and then it gets that kind of sweet flavor.
Yeah. Yeah. And and that's flavored with xylitol. The Act lozenges have xylitol.
Thank you very much. Well, I haven't had any more questions come in. So I'm going to go ahead and state our mission is fight colorectal cancer. We fight to cure colorectal cancer and serve as relentless champions. We hope for all affected by this disease through informed patient support. impactful policy change and breakthrough research endeavors. I'd like to say thank you to Dr. Jernigan, Laura, and JJ for joining us. You guys made this absolutely possible, and thank you for sharing your time and your expertise with us. To everyone that joined the webinar, please keep an eye on your email inbox. We will be linking this recording on our website and sending it out to everyone, and it'll live on our website so. Thank you also very, very much. Thank you for participating, everyone, and we really appreciate your time, JJ and Laura, Dr. Jernigan. Thank you very much.
Thank you for having me.